our Bronson Health Chat segment for this week. Bronson Healthcare is committed to advancing the health of our community and reminds us that it's time to get our flu vaccinations. And while it's important to receive the flu vaccination each year, this year it's especially critical due to the ongoing presence of COVID-19. Dr. Richard Van Enck is our guest, epidemiologist, director of infection prevention at Bronson Healthcare, talking about this year's upcoming flu season. Doctor, good morning.
Good morning, Ken.
Wonderful to talk with you again on this topic, very important topic. So why should someone get a flu shot, and who should get a flu shot?
Yes, this is a kind of an unusual year this year for influenza. We really don't know what's going to happen. Last year, we had a very mild influenza season, and typically after you have a mild season, you have a more severe season. So there's some historical precedent for expecting that this year could be a bad year for flu. We do have good flu vaccines. The vaccines seem to be working, but flu has already started in some places in the United States, not in Michigan yet, but it's coming because it does that every year.
Well, as you mentioned, last year's flu season was relatively mild. Was that strictly due to all the mask wearing, or were there other factors? And are there other factors that may indicate a heavier flu presence this season?
Yes, that's a great question. I wish I knew the answer. At this point, it looks like the flu viruses last year were about the same. You know, there was nothing different about the viruses, but I think because everyone was wearing masks and doing all of those other things that we needed to do to protect ourselves against COVID, that also worked to protect ourselves against other viruses like flu. Many of those things have been dialed back now, and so it looks like influenza might have a chance to do some spreading, and so it's very important to protect ourselves against flu this year.
Dr. Richard Van Enck is with us on WKZO, our Bronson Health Chat, on the topic of the upcoming flu season. Let's talk a little bit about symptoms, because it seems like flu and COVID symptoms are pretty close to the same thing, aren't they?
It is true, yeah. The initial symptoms that you have with influenza and with COVID are very, very similar. There's a few subtle differences. For instance, you can have COVID for a day or two before you have symptoms. Usually with influenza, it's pretty close. When you have flu, your symptoms begin. The loss of taste and smell is unique to COVID. Flu doesn't normally cause that. But other than that, yes, the symptoms are almost the same. That is fever and headache and muscle aches and fatigue. All of those things are common to both diseases.
Doctor, what's the difference between the flu vaccine and the COVID vaccine?
Yeah, the main differences are in the number of doses that you get. For the flu vaccine, we get one dose every year, once a year. With the COVID vaccine, the schedule is different, right? The two most common COVID vaccines that we're using in the United States are 2 doses. And so you get one dose and then you get another dose either 3 or 4 weeks later. And now it looks like some people should get another dose 6 months after that. And so it's multiple doses in a single season for COVID, whereas it's one dose each year for flu.
If someone hasn't yet received their COVID vaccine or is thinking about getting the booster, can they get both vaccines at the same time?
Yes, you can. They recommend that we give them in different arms, of course. Otherwise, one arm will be, have 2 injections and might be a little bit sore. And you can reduce that by dividing it up. And so we do recommend that if you need both vaccines, either your first or your second COVID dose, you can do them in the same visit if you're going to a place that has both. Some, pharmacies have both. Some doctors' offices have both. If it's a clinic, then sometimes those are just a single-purpose clinic. So it's either a flu clinic or a COVID clinic, not both. But many settings are offering both vaccines at the same time, and you can get them both at the same time.
I am happy to hear that because I did get both the vaccine booster and the flu shot at the same time last weekend. I'm fine, thank you. Finally, where can we get a flu vaccine?
Yes, there's vaccines available all over. The source that I know best, of course, is Bronson Healthcare. And so we have both flu and COVID clinics operating almost every day across 3 counties. And so if you go on the Bronson website and you look for flu clinics, you can find a schedule in many different locations and all different times of the day. You can either make an appointment so that there'll be a slot ready for you, or we also accept walk-ins.
Dr. Richard Van Eyck has been with us, epidemiologist and director of infection prevention at Bronson Healthcare. Our Bronson Health Chat segment for this week about this year's upcoming flu season and why it's critical to get vaccinated this year. Thank you so much, Doctor, for sharing valuable information with us on our show this morning. We appreciate it.
Thank you.